High blood pressure diagnosis usually comes after having your high blood pressure checked and may be one of the several types of hypertension. If you're new on this channel, kindly subscribe to this very channel. And for my returning subscribers, Nurse Princess is saying thank you. Welcome back. On today's episode, we'll be discussing about the different types of hypertension. You may have no idea you have hypertension until you are being diagnosed or your high blood pressure is being checked. That's where sometimes you will know that you have hypertension, because hypertension most times don't come with symptoms. We have 5 types of hypertension, such as essential hypertension, secondary hypertension, resistant hypertension, isolated systolic hypertension, and malignant hypertension. Number 1 on this list is essential hypertension. If you have your blood pressure recorded as high on 3 or more doctor's visits, you may have what is called essential hypertension. You may have no other symptoms, but it's not uncommon to get headache, dizziness, or fatigue. That is essential hypertension. Underline this word, which I said earlier. When you visit your doctor and your blood pressure is being checked and recorded as high for 3 or more visits, you might have what we call essential hypertension, which you need to work on. Number 2 on this list is secondary hypertension. And secondary hypertension is a hypertension caused by another health condition. This could be sleep apnea, hormonal fluctuation, adrenal gland disease, thyroid disorder, too much of salt in your diet. Even some medications can cause secondary hypertension as well. Third on the list is resistance hypertension. This form of hypertension is one that doesn't respond to medical treatment. People with resistance hypertension are more at risk with heart failure, stroke, or kidney disease. Sometimes it is caused by people not taking their medication correctly, or some people that have bad lifestyle habit that can contribute to high blood pressure. So if you are such a person with this kind of attributes, please desist from it, because you are at high risk of heart failure, kidney disease, or even stroke in the future. And also endeavor to take your medication correctly to prevent yourself from resistance hypertension. The fourth one, isolated systolic hypertension. On this very type, your blood pressure is recorded with 2 different numbers. The first is the systolic pressure. The pressure is cited when your heart beats. The second is the diastolic pressure. The pressure when the heart rests between beats. So in isolated systolic hypertension, it's only the systolic pressure that is recorded high. This type of hypertension is caused when the arteries are becoming less elastic and can cause a person risk for heart disease. Okay, to round it up, isolated systolic hypertension is when your systolic number, which is the number above, is high, is recorded as high, and the number below, which is the diastolic, is normal. That is systolic isolated hypertension. The fifth, which is the malignant hypertension. This type of hypertension is very rare and is more common in young adults, women with pregnancy, thalassemia, and men of African descent. It is a medical emergency marked by a sudden and extreme rise in blood pressure and needs immediate treatment. Symptoms include blurry vision, chest pain, confusion, headache, and numbness in the extremities. Okay guys, I know with this very video now, you are now familiar with the 5 different types of hypertension. Please visit the hospital or see your doctor for blood pressure checkup so you can be able to isolate yourself from this 5 hypertension to know if you have any of them, which you will not have. But in case you come up with any of them, you know the kind of treatment, management, or medication you need to take on it. Thank you and God bless you. And don't forget to share. You might help someone out there because a lot of people don't even know they have hypertension. Like I said earlier, this hypertension doesn't come with symptoms or signs. So please share this very video and God bless you. See you on my next video. Bye bye.